Everybody. As Dr. Curling said, my name is Mike Dawson. I'm a senior microbiologist at the William Harvey Hospital. And just a bit of history about myself. I was sitting where you are 15 years ago. And this practical was actually running then. And it hasn't actually changed very much in all that time. The only change being health and safety's come in, and whereas I actually handled the organisms we'll be talking about, you have to do it virtual technology. So, has everybody got a manual?
There aren't any more at the moment. Anyway.
There aren't any more.
There are, I'll bring them to the lab.
Okay. Get some for the lab, in the lab for those who haven't. So, as I said, this is a virtual practical, and basically what you'll be doing is you'll be looking at two individual case studies. The first case study, you'll be looking at a baby who has been presented in hospital with blisters on the skin. The second case study, you'll be looking at a consultant who works at the hospital who has an infected finger, or what we call a paronychia. And basically what we want you to do by following through the handout is to logically go through all the information that you'll be presented with in the laboratory and identify the pathogen that is causing the infection in the baby. We then want you to identify where the baby got this pathogen from. And in the second case study, we want you to identify the pathogens that are causing the infection in the consultant's finger. Doesn't sound much. There's more questions in the handout that we want you to expand on your findings. So, case study one, you've got a baby who's been born in hospital, gone home, come back, gone to the paediatric ward, and the doctors have found this baby has got blisters on the skin. You may say, so what, the baby's got a few blisters on the skin. You take a blister, say about the size of a tangerine, compare it on the surface area of the baby to the surface area that it would be on you. That blister on you would be a mild irritation, might be a bit painful, but you'll get over it. On a baby, that can then become life-threatening. So this baby has been diagnosed with a possible infection. From the clinical details, the clinical presentation, the doctors have gone, this looks a classic case of X. First thing we want you to do is to suggest what this baby actually has. What is the medical terminology for this condition? It's very well documented, and I do believe it is in MIMS. So the doctors have an idea this is what's wrong with the baby, but they need to prove it. So they take swabs of the blisters, send them to the laboratory, and that is where we culture them. We culture them onto agar plates, various agar plates, and see what grows. Unsurprising, in this case, nothing grows. So, knowing that nothing was going to grow, the doctors also sent down swabs from other sites on the baby's body. The next part of the practical is for you to decide what parts of the baby's body should they have swabbed. Now, when we're looking at infectious diseases, in some cases, the infective organism does not actually, you will not get it from where you think you would get it from. Like in this instance, you are not getting it from the skin. You're not getting it from the blisters. But there will be an infective organism there. So can any of you suggest to me why, or what is the organism doing that is producing these symptoms in this infant? How how many of you have studied other organisms such as diphtheria, tetanus? What do they produce that actually causes disease? Toxins. So in this instance, a toxin has been produced by an organism in one of the sites that has caused the baby's skin to blister. So let's screen the other sites. You've identified those sites. Marvellous. These swabs have been cultured, and lo and behold, we've isolated a Staphylococcus. What we would like you to do in the laboratory, going through pictures, videos that we've set up over the past couple of weeks, is identify what type of Staphylococcus this baby is carrying. That make sense so far? This then starts to ask other questions. You have a newborn baby, it's got a staphylococcal infection of this unknown strain that we want you to identify. How did this baby get that organism? It's not born with it, and this has occurred within a few weeks, possibly even days after birth. So where on earth could they have got it from? Now, for the purpose of this practical, we've ruled out the parents. That would be a little bit straightforward. You would say, oh, the parents are to blame. But the infection control team in the hospital have started asking questions. First question they would have asked is, where did it come from? And the first place they will say is, well, was it environment or was it staff? It's very difficult to screen the environment for pathogens, although they could potentially be present. So the first thing the infection control team do is start screening the staff. So you will also find that we have taken specimens from the staff that were on duty at the time that the baby was born. So you will have specimens from 4 doctors and 2 nurses.
4 nurses, 2 doctors.
4 nurses, 2 doctors. Thank you. And again, we have isolated different strains of Staphylococcus from each of those members of staff. And again, we want you, looking at videos and pictures that you will be presented with in the laboratory, to identify the different strains. What we then would like you to do is to look at the data. Is there any pattern? Is there something going on that ward that they don't want going on in that ward? Is the person who has potentially given the baby the infection a member of that staff? So once you've identified the organism, you need to confirm that it is actually the organism that that baby has been contaminated with. Now, one way of doing this is to compare antibiotic sensitivity patterns. It would be safe to assume that if you've got an organism that is the same, then you will have the antibiotic sensitivity pattern produced by the organism on the baby will be the same as that from one of the members of staff. Now this will require a bit of interpretation on your behalf and make up a majority of case 1. So what you will be presented with in the laboratory are pictures of antibiotic disc diffusion tests. And basically what these are is we've seeded plates with the organism that we want to test. So we've covered the plate with the organism, and then we've put on different antibiotic discs to antibiotics that we would routinely test for within the laboratory. Each plate, you will find, has 6 discs on. The discs are, what the discs are is noted in the table in your handout. And what you will need to do is compare zone sizes of inhibition of a test organism against that of a control organism. Now, we have a control organism here. it has a known antibiotic susceptibility pattern. So in this case, we know that it is sensitive to this antibiotic. We also know, therefore, that this zone of inhibition, the area where there is no bacterial growth, the size of which represents sensitive. So you need to measure the diameter of that zone of inhibition and record it. You then need to look at your test plates. So we have the organism here and the same antibiotic disc. Again, measure across the diameter of the zone of inhibition and compare the size of the two. Now, if the zone of inhibition of your test is equal to or greater than the size of inhibition of the control, it must be sensitive. Because this is sensitive, it is equal to or greater, then that one must be sensitive. If it is smaller, it is resistant. Does anybody need me to go through that again?
Yes, please.
So, you will have a picture of a control plate, and you will have several pictures of test specimens. They have the same antibiotics on them, and they've been seeded with your organism. You need to compare the zone of inhibition, the zone where there is no growth around the disc. So for this disc, we know that the zone of inhibition is so big for your control organism that indicates sensitive. Okay? You measure the same zone size on your test organism and compare the two. If the test organism has a zone size that is equal to or greater than the zone size of the control, it is sensitive. If your test organism has a zone size that is smaller than that of the control, it is resistant. Yep. We will be around, I will be around in the laboratory with demonstrators and your lecturers to help you out if there are any difficulties. So you've measured those. Now, because we've taken pictures of plates, because you're no longer allowed to handle the real thing, you'll find that we have got a ruler for in the pictures as well, so you can get a sense of scale. So there may be, you may have to do a little bit of maths to ensure that you've got the same zone sizes as everybody else, and that you've got the same zone. Basically, you have to scale up or scale down depending on the size of the picture. But any questions, please do ask. So you will have these for all the doctors, all the nurses, for the baby. You've got the table that we want you to fill in. And at this stage, you should now have an identification of the organism, the antibiogram, or the antibiotic sensitivity pattern, and you should have an idea of whether or not somebody on that ward has infected the baby. Any questions on case 1? No. So, case 2, similar principle as the flowchart I've put up there. A new consultant, Mr. Smith, has gone to his GP. Doctors have to go to their own GP. They are not allowed to prescribe their own antibiotics, much to their disappointment. And he's gone to say that he's got an infected finger. He's got an infection of the nail blade, which we call a paronychia, or in more common terms, some people call it a whitlow. These can be quite nasty, and it basically makes the end of your finger swell up quite nasty. You'll have quite a bit of pus, blistering, and if you're really unlucky, it will smell quite bad as well. His doctor has said, right, we need to take a specimen. So they've taken a swab of this infected finger, and they have now sent it to the laboratory for us to culture. So we've cultured it, and we have isolated 4 different organisms. What we want you to do, in the flowcharts A and B at the back of your handout, is follow these flowcharts and identify the 4 organisms. How much microbiology have you guys done? Quite a bit? So what if you've got an organism and you want to know what it is, particularly a bacteria, what is one of the first things you would do once you've grown it? I can hear mumblings. Anybody? You do a gram stain. You would want to look at the morphology of that organism. Is it a Gram's positive organism, as in it stains purple with a Gram stain? Is it a Gram's negative organism, as in it stains pink with a Gram stain? What shape is it? Is it a coccus? Is it a rod? Is it cocci in chains? Clusters? Are they rods in chains? Are they in clusters? First thing you will do is look at some Gram stains which we have put on the benches for you. They are prepared. All you have to do is look at them underneath the microscope. Sounds quite simple, as long as you know how to use a microscope. If there are any problems, please ask us. We will help you find these organisms. You need to record what is its Gram stain. Once you know whether it's a Gram-positive organism or a Gram-negative organism, then you will know which flowchart you will need to be looking at. And then it is a case of simply going through the flowcharts. There are videos which we'll be able to look at which will give you the answers to the tests that you will be looking at in this flowchart. Which brings me to one thing. Flowchart A for your Gram-negative organisms. We will be very kind to you and let you know that the organism, when you get to it, is motile. Now there are 2 methods for determining motility in an organism that are commonly used in the laboratory. One is to do a hanging drop test, which is where you literally take some organism, emulsify it in a drop of water, put a cover slip over the top, suspended on some Vaseline or Blue Tack, turn it over, look under it on the microscope and see if there's any organisms moving in the liquid. You're not allowed to handle the organisms, so we can't do that. The second method that's commonly used is to use a semi-liquid agar and literally just stab the agar with the organism. And as the organism grows and moves through the agar, it produces a red pigment. If it spreads entirely through the agar, you know it's a motile organism. If it moves very little, if at all, then you know that it's not motile. But that's difficult to transport and difficult to do in the laboratory, so we couldn't do that either. So we've given you that result. So the organism will be motile. So you've identified all your organisms on patient 2, and we now want you to have a look at them and decide, too far ahead. One of the organisms we have got antibiotic sensitivity tests on. And again, what we will need you to do is record the antibiotic sensitivities and compare them as you did for case 1. It's exactly the same by comparing zones of inhibition. You will then have all the results you need to sit and look at the data and say conclusively whether or not you have a contact of the patient who has got an infected finger or not. So we're taking 2 case studies, bringing them into one and seeing if we've got a happy conclusion. Who's yawning?
Are you going to go through the techniques for the Gram-positive?
Do you want me to, or are you happy with that on the video?
I think we're good.
Yeah?